Many people with epilepsy may be concerned about continuing treatment with anti-seizure medications during pregnancy, or they may be worried about breakthrough seizures during pregnancy.
Fortunately, most people with epilepsy have normal pregnancies, deliver healthy babies, and in the majority of cases, seizure frequency does not change in pregnancy.
Hi, I'm Dr. Regan Lemley.
And I'm Dr. Paula Voinescu, leader of the Brigham Epilepsy Obstetrics Clinic and Research Group.
We work together to help you have a healthy pregnancy.
We will briefly discuss common questions about pregnancy and epilepsy, and we will go through them in more detail during your visit with our team.
So first question, is it safe to continue on anti-seizure medications during pregnancy?
In the majority of cases, it is safer for pregnant people with epilepsy to continue on anti-seizure medications because uncontrolled seizures are much more dangerous. Yet, not all medications are equally safe, and we are here to help you optimize your medication regimen.
We want you to be informed on everything that we have learned from other mothers who took your medication during pregnancy, and together decide on how best to keep you and your baby safe so that you can have the very best pregnancy outcome.
Dr. Lemley, what are the risks of seizures during pregnancy?
So seizures, especially convulsive ones, are both life-threatening for both the mom and the baby. Any seizure associated with confusion can lead to dangerous accidents, and we want to avoid that at all costs during pregnancy when a simple fall may lead to a miscarriage.
The good news is that a recent rigorous study called MONID showed that most pregnant people with epilepsy have the same seizure frequency during pregnancy as during the year before.
But for seizures to remain unchanged, it showed that you need to work with your doctors to monitor medication levels in your blood, and when needed, increase the medication dose. So you may wonder, why do we need to increase the medication dose during pregnancy? Is that not dangerous for the baby?
It would be dangerous not to increase. There are so many changes in your body when you are pregnant. We know for sure that your kidneys are filtering out the medication faster, and your liver enzymes chew up your medication faster.
We check your medication levels regularly, and we increase the dose only when your level is below a number which we determine kept your seizures safely under control.
There can be many dose changes throughout pregnancy, but we are here with you along the way, and we will be in touch with you monthly to help you understand why and when you need a dose adjustment. Dr. Lemley, what complications with pregnancy can occur when the mother has epilepsy?
So there have been multi-center studies showing that premature birth, C-section rates, and other complications have been higher in pregnant women with epilepsy compared to those who don't have epilepsy. But this has not been the case with our patients here in the Brigham and Women's Epilepsy OB Clinic.
We work very closely with the Brigham Obstetrics and Maternal Fetal Medicine Group, and Dr. McElrath is a leading expert in managing pregnancy for women with epilepsy. We also collaborate with other specialists you may need, for example, psychiatry, and we can connect you with the epilepsy community through My Epilepsy Story or the Epilepsy Foundation for additional help.
So Dr. Voinescu, a lot of women ask us, what is the risk for my child to develop epilepsy?
It is actually more likely that your child will not have epilepsy. On average, the risk of epilepsy is passed down in about 5% of cases, closer to 7% for generalized epilepsy and 3% for focal epilepsies. And not everyone who inherits the genes will actually develop seizures.
And if you are interested, you can obtain a genetic consultation with Dr. Koshku, who is an epilepsy doctor here at Brigham and Women's and has both clinical and research expertise in the genetics of epilepsy.
Dr. Lemley, what do we know about fertility for patients with epilepsy?
So simply having epilepsy does not increase your risk of infertility. So women with epilepsy have the same chance of becoming pregnant as other women.
If you do have infertility and you have epilepsy, we can collaborate with our reproductive endocrinology colleagues for you to explore assisted methods of reproduction.
Now, is breastfeeding safe while taking anti-seizure medications?
Less medication enters the breast milk, and exposure through breastfeeding is much lower than in utero. Studies have shown that a small amount of medication does not harm your babies. It is safe to breastfeed, yes.
There are studies that show breastfeeding has benefits over bottle feeding, such as a slightly higher IQ, but we know breastfeeding can sometimes be difficult. Ultimately, the choice to breastfeed or not is yours, and taking epilepsy medication should not limit your choices.
We hope this information has helped you understand more about epilepsy and pregnancy.
We are here to help you plan for pregnancy or help you when you are pregnant.
Please plan. Thank you for watching and allowing us to tell you about our practice.